Well, good afternoon, Louisville, Kentucky. I am Tara Level, President and CEO of the Black Community Development Corporation. Also give leadership and I was founder of the Hope Wellness Center. I am coming to you today. It is Wednesday, December the 1st, what we've come to know as Wellness Wednesday. Also, today is World AIDS Day. And so I thought, what a great day to sit down with my colleague, Ms. Dana Smith, nurse practitioner at Hope Wellness Center, and to just chat it up about some stuff we've been doing over the last practically year now. We have been working with an organization, Black Women Learning Institute, BWLI, and they are a group of women who their mission is to improve health outcomes for Black women across lifespan. They focus and address on the complex health issues that face, that kind of disproportionately face Black women. And so our city, certainly glad to be chosen to listen and to hear from the Black women in Louisville, Kentucky, to see what their health concerns are. So Dana and I have collectively been hosting listening sessions with young women, mature women, getting them into some spaces to just hear from them. We weren't doing a lot of talking. We were wanting the ladies, Black women of Louisville, Kentucky, to share with us their concerns. And over a course of right at about 9 to 12 months, we've gathered a lot of information. And so we've recently got some of the research and data back. We're going to talk about that, right? We want to know I want to know how Dana's feeling about some of the findings. And I'd like to share some of my thoughts as well. But what we wanted to do was also share that with you, the community. So that's why we're here today on Wellness Wednesday. So Dana Smith, I've said your name now 3 or 4 times. Would you like to introduce yourself to Louisville, Kentucky, as if they don't know you?
Yes. Hello, Louisville. Hello, everyone. So grateful to be here today and having this time to have this discussion with you all. My name is Dana Smith. I am a family nurse practitioner. I am the medical provider of the Hope Wellness Center that I'm passionate about. I have almost 8 years experience as a family nurse practitioner. I have 30 years experience in healthcare alone. And so I've been very fortunate to been exposed to a lot of areas, how my people were treated, how they were cared for. And that's when I developed all of my concerns.
All right, so Dana, let's jump in, because what we know about Facebook, people, they tune in and they can quickly tune out. So we want to get right to it. So some of the listening sessions we had, just want to share some quick information about that. We held 3 different categories. So we chose adolescent, emerging adults, reproductive age women, and then our over 50 mature women. And this year I fell into that category, Dana. So anyway, we'll keep moving right along with that. Some of the biggest barriers that we discovered were kind of shocking to me, just a little bit. But one of the main things here in Louisville, and this was sort of the reproductive age and the over 50 age, found that finding a doctor that they liked was a huge barrier. So when they initially jumped right in the conversation, it didn't go right into health. It went to just, I want to find the right doctor, right? And then finding a Black doctor. Many of our women wanted someone that looked like them. And then also, we are still talking about this, but experiencing some form of racism while they're in the medical office. So when you think about some of the top 3 that were chosen based on the question, what is your major health concern? And not a lot came out right off the bat about health. It was just those I don't want to call them surface areas, but those are pretty critical. And the fact that they weren't medical was sort of concerning for me. What do you think about that?
Well, I think, the mistrust in the medical institute is profound, and it's been that way for us for 400 years. But I wasn't at all, surprised by their statements. I mean, Black women are the most neglected, unprotected, and disrespected persons in this nation. So I was definitely not surprised. And I have completely observed it and have also been an example of the mistrust and how I was treated as a patient myself.
Wow. Yeah, I hear from my friends, my circle, a lot of times that they are looking for someone like you, Dana, so that they can trust with their, and I'll just say with their life, because that kind of brings us to the next thing. So we talked about the bigger barriers, but the three top health concerns were high blood pressure was one. That's about 27%. And then we looked at breast cancer, of course. Well, depression actually was a little higher than breast cancer. So if you rank those, you had high blood pressure, depression, and then breast cancer. And as far as breast cancer is concerned, in college, I was a part of a sorority, and my line or my group was 12 women. We were all college age. This is undergrad, not graduate chapter. And out of the 12, 4 of my sorority sisters passed of breast cancer all before the age of 40. So that, so when it comes to Black women in health, firsthand, and I really hadn't thought about it until working with BWLI, that, we kind of made a focus, but we're going to target, Black women. And why is that important? Well, it's always been important. And so, hats off to the organization because they have chosen to put a spotlight on that. So what do you think about those top 3 concerns?
Well, definitely African Americans are the highest risk population for almost every disease process. And all of the research typically focuses on non-African Americans. So that alone is a barrier. But secondly, it goes back to the mistrust. If we're not seeking care because we don't trust the person who is caring for us, then we're not going to have the screenings that are so essential to decreasing comorbidities and prolonging life.
Yeah. So Dana, as a nurse practitioner who provides primary care to Black women here in our city, both younger adults as well as our mature ladies, do you have intentional conversations with those patients that maybe you don't have with any other patient?
Yes, absolutely. Because, I always factor in culture with my African-American patients. There's a different type of treatment. And when you factor those cultural changes and differences, it develops your care plan differently. And I think that's what may not happen often, is that we don't recognize the differences just based off of culturally and race. But as far as having the conversations about them saying, I can't find a provider, I can't find a Black provider that, I don't really feel comfortable. I've had 2 white providers. I have a white doctor right now, but I feel like she doesn't listen to me or he doesn't listen to me. I always tell patients pretty much everything is trial and error. And I have patients to be their own best advocates as well. You do your research, you look up patients on a computer if you have the option and availability to Wi-Fi and that you can do those things. Also speaking with just friends, word of mouth, because you may not get a medical provider. I mean, truth be told, in Louisville, Kentucky, there's not a lot of Black medical providers. All right. We probably have more than I've ever seen in my whole 30 years in healthcare now in 2021, which is good, which is good news. But at the same time, I may go into a Black provider that I do not care for, and I may not want them to take care of me. It's all about how you approach a patient. So when I say trial and error, I really recommend a patient go online if you can, ask someone that's in the profession if possible. Typically someone in your family has someone there that is in the medical field, likely. If not, they may have a friend that knows someone in the medical field. And I always say, go and try that provider, talk to them, let them know what your expectations are as a patient and then they can give you their expectations. You may not like the first person, but again, I go back to trial and error. You work and you try until you find the best provider that is for you. And that may not be a Black provider.
Right. That's some good stuff, Dana. So today, I talked about it a little bit. Today is World AIDS Day. And I was kind of just reflecting, and I realized that in my circle, my community, if you will, I don't talk about HIV, AIDS much at all. I mean, and I don't know that any of my friends have, we've probably never had a conversation about that, quite honestly, because in doing some research over the course of time, we've been listening and to women all over the city. And then we realized that Black women account for nearly 60% of new HIV infections, despite being 15% of the population. That's huge, right? So we should, I'm going to ask you the question because I'm not the medical professional, but so should we still be concerned about HIV? Should we still be concerned, or should we now get concerned if we weren't?
I think we should have always been concerned. I think as a medical provider, and I'm speaking for myself, I think after we started to have better forms of treatment for HIV, we kind of didn't talk about it a lot. But did we ever really talk about it? I think when we were in the pandemic of HIV and AIDS, especially, I think it first came here in 1970 and it was to New York City. And then in 1981, it really started to ramp up the numbers as far as positive cases and the number of deaths. Yes, we were talking about it, but it was kind of considered a gay disease. Okay. So we thought that if we weren't gay, this is not something that we should be even discussing. For me, I feel like it should be a part of a primary care screening. I think just as we screen for breast cancer, as we screen for lung cancer, we screen for STIs at every single visit. But now the most concerning thing for me was since the pandemic, we kind of let a lot of disease processes go to the wayside. But we had like a little over 120 brand new cases in May of 2021 here in Louisville, Kentucky. And we typically have about 144 annually. So that is alarming. I mean, extremely alarming. So if we're not having the conversations, I think as medical providers, we have to go there and we have to make sure that the care we say that we're going to give our patients, because they rely on us for the recommendation. So I think it is really our primary responsibility to educate our patients on it and the importance of being screened for HIV and AIDS. It can save lives.
So, and I'm just, everything that we're talking about, I just kind of really want to keep the focus on Black women, right? And so, we know we have the highest rate. And then when it comes to and death, and not only HIV or AIDS, but in every other category. I spoke about the breast cancer situation with my sorority sisters, how is it that 4 of those young women died of breast cancer before the age where they were even to be screened? And so, that's alarming, right? And so when you look at HIV and, why are we, again, disproportionately affected? Just why? Is it the lack of education? Is it from the medical standpoint, or us as well?
From medical standpoint and community-wide, I feel like that we're just not having these conversations.
Yeah.
I feel like we're acting like it's not a topic of discussion or concern. And I think part of that deals with, as far as culturally, it could be as far as shaming, feel that this is not something you don't want to discuss because you're concerned of how someone will feel about you or being judged. And so I think a lot of that, and then of course they'll say, well, I've had a patient say, well, I'm not gay, I don't need to be screened for HIV. And I'm like, well, that's not just a high risk factor for contracting HIV. I mean, it could be occupational health. Let's just say for medical providers. I've been stuck by a needle and been exposed to a bloodborne pathogen twice in my career. And I've been tested for HIV 2 times now for 10 years straight. And so, I mean, I'm just giving that as an example, but it's just like let's say the middle class African-American woman who is married and thinks she's okay, but may not know that there are infidelity issues that she may not be aware of. That puts her at risk. He's at risk for multiple sex partners, and now she's at risk because he has now exposed her. So these are just conversations that I think that we need to start talking about so that we don't feel ashamed to talk about it.
So Dana, just, so we're talking about HIV, and I'll, be the first to say that I'm really not sure of some of the, I don't know if it's guidelines or precautionary numbers, but how often are you to be tested for HIV?
You should be screened for HIV at least annually, but also anytime there is a potential exposure. So that might be 3 months, that might be 1 month, but each time that you have been exposed that puts you at risk for contracting HIV, you should be screened for HIV.
Okay, so it's sort of it's according to your lifestyle. So it's one of those things that you're being tested based on your lifestyle. And speaking of lifestyle, I do know that now, there are some treatment and drugs that people are living normal lives, and their lifespans will be just as long as someone who has not been affected with HIV.
More than ever now. And so that's why it's so important to ensure that that patients have access to the care that they need, because the treatment is phenomenal and people are living long, healthy lives from even that's diagnosed with HIV.
I'm not being funny when I say this, but so, you've got the whole Magic Johnson was cured kind of thing, but I do know of people that have been treated to the point that it's like no longer, I don't know if it's like they can't be detected. I guess that's how you would call it. But so, yeah, it's almost like a cure to some degree. Not, would you call it a cure? Or
no, we don't actually have a cure for HIV and AIDS, but we have patients who are very well controlled. They're living very healthy lifestyles, and their life expectancies are very long. And that's good news.
Yeah, so good. Well, I certainly think that we will continue to have this conversation. So that kind of leads me to my kind of the last question I have for you, and then you can, if you've got something for me, but I have to ask why you chose the Hope Wellness Center as your place for practice with your private practice. What was your decision as to why you came to the Hope Wellness Center?
Well, the decision was really simple but it was threefold. So it was my dream to practice independently. I just wanted to be a part of, be a kind of a change agent for providing what I've been seeing, little care to substandard care to providing good care. The other thing was it was limited access to health care for African Americans in the largest community here in Louisville, Kentucky. Very limited. I mean, it was shameful. And then the other thing was I really get to connect and I get to focus on the treatments that worked more effectively in us. And so for me, that was just so important. I'm just really overwhelmed about the opportunity that I have had, the joy I've had in taking care of my patients and how much they mean to me. So I'm just grateful for the opportunity to be walking in faith, really. And the care that I offer at the Hope Wellness Center is primary care, urgent care. We do lab work, blood work. They can get HIV screening there. We give vaccines, primary care. So I manage like all of your preventative screenings. I order those. I ensure that they're completed and followed up on, and the extended care that you may need versus the results. So basically all general healthcare as far as primary care and urgent care, like acute illnesses. You can be sick with a cold, strep throat, but basically I manage primary care. So all screenings I do, and I manage those.
Yeah. So, well, again, I'm super proud for you to be at the Hope Wellness Center. And then in regards to the Black Women's Learning Institute, that was something that, of course, was not on my radar. I did not know about the organization, but I mean, it was truly, a faith and a miracle that they reached out to us, because it so aligns with what the Hope Wellness Center is doing and wanted to do. And so BWLI actually kind of gave us that push, if you will. And I don't know if you agree, but I think you will, because we talked about it, but they kind of gave us that push to dig deeper in regards to Black women. Our focus was Black people in general. But with all of the disparities that we've heard in regards to the Black woman, it was just so befitting that that we have connected and partnered with that organization. And even now, more so post-COVID, we can kind of, if you will, get back to overall health. We can kind of move forward. And so I'm just really, really excited about the continued work we will do with this organization. But any last words you want to share to your community who's watching now?
I just want to say that just know that I care for you. My concern is your health, and I am here to provide you good care, and that your loved ones need you here. So please do your due diligence as far as seeking medical care and your screenings. And what I really want Black women to walk away with is the stigma that surrounds HIV and AIDS still is an issue in this community. And the only way we can improve this is to continue to have these critical conversations to improve Black women's health and wellness.
Yeah,
I was just going to mention too, the Hope Wellness Center is located at 2600 West Broadway. It's inside of Lyles Mall. It's a Suite 208 right here in Louisville, Kentucky. And we will be happy for you all to call us. Our phone number is 502-618-0543. And you can make your appointment to either get primary care, screenings, anything you would like done. We would love for you to call us. Thank you.
And also, this will be showing, or is showing on our Hope Wellness Facebook page, as well as the Black CDC Facebook page. And so you can always direct message us there as well to make an appointment to reach out to Dana or any other staff at the Hope Wellness Center. All right, so we've talked about some great stuff, Dana, and we will certainly keep this conversation going. But as for today, I will let you get back to work, and I'll do the same. Thank you.
Thank you.